Hi everyone. Today in this video we are going to discuss about side effects of statins. Statins are one category of drugs which are classified as antihyperlipidemic agents. These drugs are having the suffix statin, but actual suffix of these drugs is the vastatin. We have so many drugs with similar suffix such as Simvastatin, Atorvastatin, pravastatin, rosuvastatin, lovastatin. All these drugs are well known as statins and they are antihyperlipidemic agents. These drugs are going to reduce LDL cholesterol within the body. Thereby they can reduce the risk of atherosclerosis and other cardiovascular disorders. But the primary site of action of these drugs is the liver. So these drugs can enter the hepatocytes where they can inhibit the cholesterol biosynthesis. And when this cholesterol is not biosynthesized within the liver, they can increase the uptake of cholesterol from the blood into the liver. In this way, they can reduce LDL cholesterol within the blood. But as the site of action is the liver, these drugs can also produce side effects that are related with the liver. So today in this video, we are going to discuss what are the different side effects of statins and which type of organs are affected, what are the symptoms we will discuss in this video. So as we have discussed earlier, statins can affect the liver and they can affect the skeletal muscle. They can also produce some gastrointestinal disturbances, and finally they can affect central nervous system resulting in dizziness and other side effects. But before going to see how these side effects are produced, let us see how these statins act. So now let us see how statins act. Statins are going to reduce the LDL cholesterol. So by the effect of statins, the LDL cholesterol levels within the serum are going to be reduced. So they decrease the LDL cholesterol, which is also called as bad cholesterol. So this LDL cholesterol is responsible for development of atherogenesis, which may result in the increased risk of stroke in the patients. So statins are going to reduce the LDL cholesterol. At the same time, these drugs are going to increase the levels of HDL cholesterol. This HDL cholesterol is also called as good cholesterol, which can reduce the risk of atherosclerosis. And by these two actions, statins reduce the total cholesterol levels within the body. All these actions of statins are related with their action on liver, hepatic system. So statins can also produce the side effects that are related with the hepatic system. So within the liver, cholesterol is biosynthesized by the HMG-CoA pathway. One of the important intermediate is the HMG-CoA. This HMG-CoA can be reduced by one of the enzyme HMG-CoA reductase. Now by action of this enzyme, HMG-CoA can be converted into mevalonate. In this way, HMG-CoA reductase plays an important role in conversion of HMG-CoA into mevalonate. Then this mevalonate can be converted into cholesterol by several steps. But among these steps, the conversion of HMG-CoA into the mevalonate is the rate determining step. So the turnover of cholesterol biosynthesis is mainly controlled by HMG-CoA reductase enzyme. That's why statins can target this enzyme. So statins can enter the hepatocytes where they can block this HMG-CoA reductase enzyme. By inhibition of the enzyme activity, they can reduce the biosynthesis of cholesterol within the liver. Now, when the liver is not synthesizing the sufficient cholesterol, it can get the cholesterol by expression of LDL receptors. These receptors are expressed on the hepatocytes, which can take the LDL cholesterol within the blood. Now, the LDL cholesterol can bind to these LDL receptors, which is then going to be internalized by lysosome. Now, the lysosomes can digest this LDL cholesterol and it can release as cholesterol. In this way, by inhibition of biosynthesis of cholesterol within the liver, more cholesterol is going to be uptaken into the liver such that LDL cholesterol levels within the blood are going to be reduced. When these LDL levels are reduced within the blood, they can reduce the risk of atherosclerosis and other cardiovascular complications. So this is how the statins act on the liver. But since their site of action is liver, they can produce the side effects related with the liver. So now let us see the side effects of statins. The first one is the liver dysfunction. So statins can modify the liver functionality and particularly they can increase the liver enzymes. Two important enzymes such as ALT levels, alanine transaminase levels, and AST levels, aspartate transaminase levels are going to be elevated when the statins are prescribed for longer period. Suppose this is a normal level of liver enzymes and this is the upper limit of normal liver enzymes. By use of statins, this upper limit may be increased up to 3 times, which indicates some hepatotoxicity. And particularly this liver function can be observed within 3 months of the treatment. So liver dysfunction can be developed within the 3 months of statins. Particularly when they are used at high dose, the risk is more pronounced. That's why few of the symptoms should be closely monitored in the patients. If patients are having any severe abdominal pain, unexpected fatigue, weakness, and some dark colored urine which indicates some blood component in the urine, and any symptoms of jaundice such as yellowish discoloration of the eye or skin, all these symptoms indicate some liver dysfunction in the patients. And particularly this liver dysfunction can be increased with increased dose of statins and their duration of treatment. So when these statins are used at high dose such as 80 mg for longer periods such as greater than 3 months, we can observe some liver dysfunction. That's why when these drugs are used at high dose for longer periods, liver functionality test should be done after 3 months of the treatment in order to assess any liver dysfunction in the patients. Second side effect is the myopathy. So statins can affect the skeletal muscle functionality and they can produce some muscle dysfunction resulting in increased muscle weakness, increased muscle tenderness, stiffness of the muscle pain, and even increased levels of creatine kinase which indicates some muscle damage. All this can be observed in the patients with use of statins again for longer periods. So CK levels should be again monitored when the statins are prescribed for longer periods. So suppose these are the normal CK levels, they can be increased up to 10 times of normal upper limit which indicates some muscle damage. And when these CK levels are excessively increased, they can produce another symptom, rhabdomyolysis, the loss of muscle fibers leading to muscle damage, which may also affect renal system that may result in some renal failure in the patients. And with increased renal failure, it may lead to the increased loss of myoglobin within the urine, resulting in myoglobinuria. So all these are related with the rhabdomyolysis, which can be rarely observed in the patients. But when the CK levels are excessively elevated, it may lead to rhabdomyolysis and some renal failure in the patients. Various factors can also increase the risk of myopathy and rhabdomyolysis. In the patients with age greater than or equal to 65, the risk of myopathy is more pronounced. Similarly, the gender of patient can also influence this myopathy. Female patients are having a more risk for development of myopathy compared with the male patients. Or any pre-existing renal impairment in the patients can also increase the myopathy. And uncontrolled hypothyroidism, all these factors can increase the myopathy and rhabdomyolysis that can be developed by use of statins. Similarly, statins are converted into metabolites by CYP3A4 enzymes. These are the hepatic metabolic enzymes. We have so many types of drugs which can inhibit the activity of this enzyme. For instance, azole antifungals such as itraconazole, ketoconazole. Similarly, macrolides like erythromycin, clarithromycin, protease inhibitors like ritonavir, immunosuppressants like cyclosporine. All these drugs are the strong inhibitors of CYP3A4 enzyme. So these drugs, when they are given along with the statins, they can inhibit the metabolism of statins. Thereby they can increase the levels of statins within the blood. And when the levels of statins are elevated, it may increase the risk of myopathy developed in the patients. Similarly, if you have the drugs such as verapamil, diltiazem, both of these drugs are calcium channel blockers. Similarly, amiodarone, amiloride, all these drugs along with grapefruit juice again can inhibit the metabolism of CYP3A4 enzyme. But these are the moderate enzyme inhibitors. That's why strong inhibitors should be contraindicated with the statins, whereas with the moderate inhibitors, the dose of the statin should be reduced in order to prevent myopathy and rhabdomyolysis in the patients. Third one is the gastrointestinal side effects. Statins can also produce some gastrointestinal disturbances resulting in the flatulence, fullness of the stomach, dyspepsia, indigestion, nausea, abdominal pain. They can also produce some inflammation of the liver resulting in hepatitis, block of the bile flow resulting in cholestasis. All this can be observed with use of statins. Fourth one is the central side effects. Even statins are acting peripherally, they can also produce some central side effects. One of the important side effects is that these drugs can increase the dizziness in the patients. So they can increase the lightheadedness in the patients, which may increase the risk of falling sensation, and they can also produce insomnia, lack of sleep. Other side effects include headache as well as vertigo that can be observed with use of statins. Similarly, we can find other side effects along with the statins. So these drugs can affect the respiratory system, resulting in bronchitis, inflammation of the lungs, or even sinusitis, inflammation of the sinus. And it can also increase the blood glucose levels, resulting in the elevated HbA1c levels, so which may lead to increased risk of diabetes mellitus. And importantly, these drugs can increase the risk of hemorrhagic stroke in the patients. So if patient is already having any history of stroke, these drugs should be carefully given because they further increase the risk of stroke in the patients. And it can also produce some hypersensitive reactions such as skin rashes. All these are the other side effects we can observe with the statins. So these are the various side effects of statins. The main side effects of statins are the elevated liver enzymes, which are observed with 3 months of the treatment and with increased dose as well as duration. They can also produce myopathy, resulting in the muscle weakness, tenderness, muscle pain, and it may also lead to the severe rhabdomyolysis, which may associated with some renal failure and myoglobinuria. And the risk of myopathy and rhabdomyolysis is further increased with various factors such as age greater than 65, female gender, uncontrolled hypothyroidism, and any renal impairment in the patient, or other drugs which increase the levels of statins due to inhibition of CYP3A4 enzyme. So when these statins are given, care should be taken to monitor liver functionality as well as skeletal muscle functionality. Apart from these side effects, statins can produce gastrointestinal side effects, central side effects like dizziness, headache, vertigo, and other side effects such as bronchitis, increased levels of glucose, and any risk of stroke in the patients. So that's about the side effects of statins. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.